Hi, I'm Hannah. I'm Andy.
I'm John.
And today we're talking about our CHF patients.
Heart failure is when the heart is failing to move enough blood throughout the body, so there's a decreased cardiac output. This can be caused either by right ventricular damage or left ventricular damage, and it can be caused from conditions such as heart hypertension, coronary artery disease, and just repeated heart conditions like heart attacks or strokes. So the patient that I had was a 79-year-old female with the initials of SM. She had no known allergies and was DNR-DNI. She was admitted to the hospital with ascites and congestive heart failure. The medications she was on for congestive heart failure were spironolactone, which is a diuretic, digoxin, which helps the heart contract, and bumetanide, which is also a diuretic. Some signs and symptoms that she had were severe edema, +4 pitting edema in her lower extremities, and she had very bad ascites as well. She also was tachycardic, she had fatigue, she had weight changes due to her edema, she had severe weight gain, and she also had an enlarged heart due to her heart working so hard. Her labs, she had an increased BNP of 235, which shows damage to the heart. Red blood cells were decreased 3.8 and BUN was increased 40. She also had several risk factors such as hypertension, CAD, and diabetes.
My patient, unlike John and Hannah's, has left-sided heart failure. Left-sided heart failure happens when the left side of the heart is failing. It no longer can receive the blood being delivered from the lungs, resulting in a pressure buildup, causing fluid to leak back into the lung tissues. My patient is RE. He is a 69-year-old male who lives by himself and does not need any assistance with home cares or self-cares. RE has no known allergies and is on a full coat. He is on furosemide, aspirin, enoxaparin, metoprolol, and pravastatin due to his previous chronic problems, plus his new diagnosis of congestive heart failure. He came in with complaints of shortness of breath. Upon admittance, he was diagnosed with left-sided congestive heart failure. His vitals were 86 beats per minute, 129/87, 97.5 degrees Fahrenheit, 18 respirations, 95% oxygen. His risk factors for developing CHF is a history of hypertension, stroke, hyperlipidemia, and an elevated troponin. Some of his pertinent lab values were his BNP was 195, his electrolytes, his sodium was 135, magnesium was 1.2, phosphate was 0.9, potassium was 2.9, calcium was 2.3. Some of those electrolytes are going to be decreased just due to the fluid buildup in his lungs. And with his CBC, his red blood cell count was 3.6, his hemoglobin was 10.9, and his troponin was 0.89. Some of the symptoms that I observed for this patient was he was short of breath, he had a +1 pedal pulse, and he also had slight crackles in the lungs, and he had lower extremity edema just due to that fluid buildup.
The patient has signs of both right and left-sided heart failure. So JW is an 81-year-old male. He has no known allergies and was full code. He came to the hospital complaining of left-sided chest heaviness, and they diagnosed him with atrial fibrillation with rapid ventricular response. His vitals his pulse was 87, his respirations were 18, his blood pressure was 132/84, and his temperature was 98.2. He was on 2 liters of oxygen. In the past, the patient had been diagnosed with stage 3 chronic kidney disease, circulation issues, hyperlipidemia, hypertension, impaired gas exchange, and peripheral vascular disease. So his high blood pressure and high cholesterol contributed to his heart failure. My patient is on multiple medications for the heart failure, including Eliquis, aspirin, athrostatin, metoprolol, and furosemide. My patient was ANO times 4, had his heart rhythm had AFib. He had lower extremity edema and regular breath sounds. However, he was on 2 liters of oxygen and had shortness of breath while walking. He does have the stage 3 kidney disease, which probably resulted from his poor cardiac function. There were a couple lab values that were off. So he had a very low GFR of 48 and a high creatinine of 1.66. And this is because his kidneys were working harder to excrete and filter waste from his body. And then his troponin was very high at 0.98. And this is because there was a lot released in the bloodstream after the patient's afibrillar with the rapid ventricular response had occurred.
You would assume that our patients would be treated with diuretics to get rid of excess fluid and to help lower their blood pressure. Patients could also be on cardiac medications to help increase heart contraction and to help increase cardiac output and decrease the edema. You would want to get daily weights and check their INOs to check for fluid retention. You'll also want to do some heart monitoring through the ECG and pulse ox and do an echo to look at heart function, heart size, and ejection fraction.
To include in the patient education, this would be daily weights. So if they gained 3 pounds in 2 days or 3 to 5 pounds in a week, they should report that to their doctor. They should also increase their physical activity and make sure they're taking their medications as scheduled. A diet that we found that is kind of preventative and a helpful tool in cardiac patients is the Mediterranean diet. So in our research article, we found that this diet consists of daily consumption of veggies, fruits, and whole grains, as well as healthy fats, weekly intake of fish, poultry, beans, and eggs, and then moderate portions of dairy products and limited intake of red meat. This diet is low in sodium, which will help with their fluid retention.
Thanks for watching!